Today we're going to talk about diabetes and the importance of routine palliative foot care. A multitude of problems typically occur from diabetics, and we've discussed wounds already. Simple things that we recommend, especially if you're a diabetic, are routine evaluation by a podiatrist. Typically, we recommend approximately you be seen about once every 3 months for an exam. Typically, the things that we will do while you're in the office are check for circulation problems, neurologic problems, and or biomechanical problems of the feet and the way you walk. Sometimes we'll actually do what we call a gait exam as well. See if you're walking either on the outside of your foot or on the inside of your foot, or have some kind of arch or ankle problem. The reason it's very important to do this is to decrease any kind of problem such as an infection from occurring. Routinely in the office, we provide nail care for patients that are diabetic. The problems typically can be anything from a fungus nail. Fungal nails typically cause a discoloration of the nail. We have a wonderful array of topical treatments that can actually effectively kill the fungus in the nail. Sometimes we have to apply topical medications as well as oral medications, and we can diagnose the actual fungus by sending the nail via a biopsy. The other problems are the calluses that we've discussed before. Calluses are a hardening or a thickening of tissue. Typically, we call a corn a lesion that occurs on the top of a toe. It's typically occurring from a bony prominence that's rubbing up against the top of a shoe. A callus is typically a lesion that occurs on the bottom of the foot, and it typically occurs in a bearing of weight area that is caused from a bony prominence. And we need to typically palliatively shave down the lesion so that it doesn't become problematic later on. The other treatments for a callus are making a certain type of a shoe with a certain type of an insert. We call that an orthotic. That will decrease pressure at the area and effectively typically get rid of the actual lesion. Sometimes, if all conservative treatments fail for these lesions, we may have to provide a minor surgical procedure to prevent the callus from becoming an ulcer or infection. We have a wonderful treatment regimen in our office with a multitude of different creams for dry skin. Dry skin can cause fissures or cuts in the actual skin, and that will typically open up and become an infection later on. You can actually see them sometimes. They become white cracks and they open up, and it's very hard for the skin to close and seal itself. So moisturization of the actual foot is extremely important for diabetics. We try to prevent any kind of opening or sores that can occur from either a crack or a callus.